My name is Tom Burke. I'm the president of St. Francis Hospital. Please accept my welcome to the community, our colleagues, and our honored guests in attendance to honor victims and to bring attention to the ongoing devastation caused by gun violence. I now want to welcome Jerry Gallipo, our Executive Director of Mission Integration at St. Francis, to offer an
happened on a Friday afternoon, April 15th of this year. It was Good Friday, the day that Christians remember the crucifixion of Jesus of Nazareth. I left the hospital that afternoon to drive to the Cathedral of St. Joseph right down the street for the 3 o'clock service with Archbishop Blair. But I noticed many of the streets around asylum police cars. I connected to a local news station on my phone when I got to the cathedral and discovered that just a few hours before, in the daylight, a 25-year-old man named Michael Foley of Hartford had been gunned down and killed in the 200 block of Sigourney, right outside here. I sat at the Good Friday service at the cathedral, listening to the account of the crucifixion and death of Jesus. A few weeks later, I was reflecting on this experience with Archbishop Blair, the Archbishop of Hartford. His remark, quote, "We are still crucifying one another through senseless gun violence. We are still crucifying one another." So I ask you to join me in prayer. Oh God, our hearts are broken with pain at the senseless deaths caused by gun violence, right here in our own Hartford neighborhoods, in Buffalo, Uvalde, and at St. Francis Hospital in Tulsa. Families mourn, children live in fear, and some in our nation respond by arming themselves with more guns with greater capacity to end life. Our disconnection and alienation has caused some to turn to guns for protection and safety. O God of peace, we ask that you touch our hearts with your love, heal our brokenness, and turn us away from violence toward peace. Bring comfort to the families of those who have lost loved ones. Welcome those who have died into eternal life. Help us to transform our own hearts and to seek peaceful ways of resolving our differences. Let our hands reach out and connect with those who feel alone, those who live in fear, and those suffering from mental illness. We ask this in the name of the God who desires that we live together in peace. Amen.
Thank you, Jerry. I want to say for a minute a special thank you to our local, state leaders in attendance, and I'll cite some of them. I hope I don't miss anyone. Andrew Woods from Hartford Communities That Care, Deborah Davis from Mothers United Against Violence, Jackie Santiago from Compass Youth Collective, Patricia McIntosh of 2013, Hydea Pendleton, I think we all know her story, a 15-year-old high school sophomore, shot and tragically killed while standing in Harsh Park in Kenwood, Chicago. just after taking her semester exams. She was an honor student and a majorette at King College Prep High School. And just 1 week prior, she had performed at President Obama's second inauguration. Her death, as you know, drew national spotlight and stands as a reminder of how easily and abruptly gun violence can take our loved ones from us. Haidia's friends began wearing orange, the color that hunters wear to signal to others not to shoot them, to say, "Don't shoot me." And now orange has become the defining color of gun violence prevention efforts nationwide. As we all know, and as Jerry highlighted for us, today's ceremonies come at a time of deep grief throughout our nation as mass shooting events in Buffalo, New York, and Uvalde, Texas, and among other locations, unfortunately, have affected so many people. For each victim of gun violence, there are scores of others who are directly and indirectly affected: mothers, fathers, brothers, sisters, aunts, uncles, children, grandparents, classmates, friends, cousins, teachers, and many, many others. We know that gun violence deeply affects our communities and our neighborhoods right here in Hartford, and we stand here today with partners and organizations committed to ending the scourge of gun violence in our city. We offer our deepest sympathies to all of those who have suffered tremendous losses. We stand in solidarity with our local and national leaders who are here with us today, committed to making a change. And we offer our hope that just as we are standing here in unity today, that the nation will come together against this ongoing public health crisis. I now want to introduce to you Dr. Stephanie Montgomery, Chief of Trauma and Acute Care Surgery at St. Francis. Dr.
Thank you, Tom. Ladies and gentlemen and distinguished guests, welcome to St. Francis Hospital. I am Dr. Stephanie Montgomery, and I have the privilege to be the Chief of Trauma and Acute Care Surgery and the Vice Chair of our department here. According to the Gun Violence Archive, which defines a mass shooting as whether 4 or more people are shot and killed, as of this morning, there have been 233 mass shootings in the United States this year alone. 233. Gun violence takes the lives of over 100 people every day, and our children are more likely to die from being shot than any other reason. Let me say that again. Your children, my children, our children are more likely to die of a gunshot wound than any other reason. I'd like to ask you why. As a mother, as a community member, and as a trauma surgeon, I'm pretty angry. We stand here every year and we see nothing changing. We are furious that these mass shootings events continue to happen across our country at an astounding rate. We are also heartbroken at the devastation that gun violence causes right here in neighborhoods of our own capital city and across our state every single day. We see it far too often in the news. We hear about it, read about it every single day. We should not, as a people, become numb to this. Our children should not have to participate in active shooter drills and hide under their desks in their schools. Parents should not have to consider buying bulletproof Kevlar for your child's backpack. Our community members should not have to fear walking into a grocery store or just living their lives out in their neighborhoods. We can do something about this. Thoughts and prayers are not enough. We need legislation. I thank our leaders in attendance who continue to fight to make legislation a priority, and I implore you all to keep fighting so that hopefully one day soon we don't have to stand here another year seeing nothing changing. On behalf of my trauma team, however, here at St. Francis, I promise that we will continue to stand with all of those that are affected by this scourge with the knowledge that gun violence is preventable. Thank you. I'd now like to introduce Andrew Woods from Hartford's Communities That Care to say a few words.
Yeah, thank you, Dr. Montgomery. Sure. Folks, my name is Andrew Woods, Executive Director of HCTC. While there is important conversation happening about gun violence in the wake of Buffalo, Uvalde, we must also talk about, as mentioned earlier, the daily drumbeat of gun violence that happens in communities all across America. Gun violence affects hundreds of families every single day, and just because something doesn't make the headlines does not mean there is not important work that needs to be addressed. There are programs, funding, and policy solutions that can help change our culture of gun violence, including helping young people become advocates for change, especially here in Connecticut, where we lead the country with some of the toughest gun laws on the books. However, there is more we can do to address gun violence, such as cracking down on straw purchases, addressing the interstate transfer of guns, and directing funding and resources to groups on the ground in these communities doing the work to curb gun violence and support victims of violent crimes, such as we do here at St. Francis Hospital in partnership with the groups that you see on the stage. In 2004, we at HCTC partnered with St. Francis Hospital to establish the first hospital violence intervention program in the state of Connecticut. Most recently, the city of Hartford, and you'll hear more, invested resources to create a citywide HVIP program that includes Connecticut Children's Medical Center, Hartford Hospital, Compass Youth Collaborative, and Mothers United Against Violence, to not only prevent community violence, but also to support those affected by violent crime. So today I'm proud to be here today with our partners, our governor, Congressman Larson, who's in his absence. Good to see Councilman Nick LeBron here, and others as we maintain our commitment to address this most important and serious issue. Thank you for your time. The next person is Jackie Santiago.
Thank you, everyone. I wish I could say it's a pleasure to be here, but I know that we remember the issues of gun violence in our communities, and our hearts are all heavy for all of the incidences that have happened nationwide. But I am happy that I can count on partners as we look across the audience and see how many people are committed to making a difference. And ultimately, I think that is what's going to make and create the positive change that we need in our communities. I think of Jakari, who tells me that he's out in the north end of Hartford riding his bike, and he gets a gun pointed at him. Thankfully, the gun jammed and he was not shot. But then we have another student who tells us she sits in front of her desk to get ready to do her homework, and she receives a call from her best friend, and at that moment, a bullet flies through her window and hits the seat where she was sitting to do her homework. She said had she not gotten up to get that phone call, she would have been another victim. We have another youth in our program who tells us about how her uncle was stabbed and killed in the stairway of her apartment building. We see these incidences every day, and I'm proud to work with our Compass Peace Builders who are out in the community, whether it's at 10 a.m. or 2 in the morning, to make sure that we respond to incidences of violence in the hospitals, and from that moment, just being a support to the youth and families that we serve. We're providing them with case management, wraparound services. Heck, they're even looking for opportunities to give them shelter because they may be homeless. There are so many issues that affect our youth each and every day that impact the levels of gun violence that we see in our communities, but I'm proud that we're working with dedicated peace builders who are out in the community, risking their own lives at times, to make sure that they are that mentorship that youth need. Some of them are living, breathing testimonies of what can happen when they change their lives around. They were both drivers and victims of violence that have changed for the better, and now are using that testimony to help other youth rise from these challenges by using the cognitive behavioral theory, by connecting them back to school, by being that support and that caring adult that they need when they need it most. I am also so proud of the fact that we get to be a part of a collaborative where we work with Hartford Communities That Care, where we work with Mothers United Against Violence, the City of Hartford, and Trinity Health, Connecticut Children's Medical Center and Hartford Hospital. This work cannot be done alone, and you'll hear me say that often. It really does take a partnership of different efforts to address an issue of violence that is multi-pronged. So I do have hope that things will change, and it exists here in this room. So thank you, everybody, for your support of the work and working hard to prevent gun violence. Thank you.
Good morning, and on behalf of Mothers United Against Violence, our co-founders, Reverend Henry Brown and Henrietta Beckman. This morning, we drove through the neighborhood, watching the doors, storefronts, and thinking to ourselves that if one person would speak up, if they knew something, and they could actually say something. This morning, as we peered into the households of this small city of Hartford, we noticed that there are a lot of individuals that know things before they happen. And our prayer was, as we talk about mass shootings and mass violence, our prayer was, if you see something, say something. And that is a motto that I know that we carry on a day-to-day basis. But with our mothers having to go through and the families having to go through every day this task of making sure that their children get to school okay without seeing yellow tape in his or her way. Not wanting to always walk your kid to school, but you know that you have to. And it has become part of a norm in our cities and in our urban cities and across the country. Because where in America did we ever think that we could not send our kids to school and have them to be safe? And for us as mothers, as family members, as fathers, as children, as siblings, as community members, where we live is the most important place where we should be safe. And unfortunately, we've had to look at our synagogues, our churches, and when I think about Charleston, and when I think about Buffalo, and when I think about Columbine, and when I think about all of the mass shootings that we've had throughout this country, it devastates us every day. And it does take our communities back into trauma level. And that is a real life situation. Most of our moms prepare themselves to help other moms so that they can get through the process. And it doesn't matter where they're at. If they're at the hospital, if they have to go through the criminal justice system, if they have to make sure that they maintain getting their kids back to school, and them having to become stabilized into getting back into their own positions of wanting to become viable citizens in the community. These things are so important, but more importantly is our advocacy, our frontline work that we do to make certain that these moms are not going through this process again. And that peer-to-peer process for us is really key. It's not just saying that you have gone through it. It's saying that you have gone through it, but now you want to help somebody else. And it's not just a job for us. It is now saying that we are doing this as part of our passion, as part of heart work. We have some moms here that understand how important it is to have a group like ours because we know the senseless feeling of guilt in some sense. We know the senseless feeling of loss. And then we always say now from a survivors conference that our children were taken from us. Our children were not lost. They were taken from us by someone who did not think a life was worth living. And with that, our hats and everything that we have in our heart to work in a collaborative through the HVIP and with all of our partners is really key. But it is going to take the collaborative and the community. And of course, what our governor has done to stand up to this entire country and having the state of Connecticut lead in the laws for us to be protected. And so it is the red flags that we have to fight for. We do have to be able to notice if our families are experiencing mental health issues and speak up and say something. That's really key. Don't let it go, because someone may be in your family. And invariably, there's one person in everyone's family that has mental health issues. But people do. They go into denial. And that is a normal way that folks deal with it. And it's unfortunate. But we have a lot of work. And it is still a lot of work. Over 700 vigils since 2002. That pains us every day. And they're senseless. They're senseless. Your sneakers, your girlfriend, the way you speak, where you walk, what side of the street you're on, where you live. Our entire lives have been unraveled by gun violence. And now it is time for us as a collaborative, and this includes the community, this includes everyone. It's where you live that now we have to speak up, and we have to be more proactive than just reactive, because reactive continues to put us in the back seat. And as I read the New York Times this morning, I noticed there's another mom and there's another family being shattered by gun violence. And it doesn't just impact that family. It impacts the entire community. And then it goes beyond. It impacts this country. So get your, whatever it takes for you to muster up some of that wanting to be out on the front line to be able to help, because there is room for everybody. And our thanks to all of our partners, Compass, HTCC, and all of our partners through the HVIP program. We are really excited about the fact that we can move together, which is really important. And I thank you.
Thank you. Good morning, everyone. Thank you for coming together today. Definitely not a comfortable place to be. I think this world is very uncomfortable right now, so I can just feel it, and I have to appreciate that. I am Patricia McIntosh. I'm with the Office of Community Safety and Wellness for the City of Hartford. This office came about because Mayor Bronin and the COO, Thea Montanez, really believe that the city has a very important role to play in addressing issues that impact the safety and wellness of our community, including gun violence. As you heard from everyone ahead of me, we recently did announce the new initiative called the Hartford Hospital-Based Violence Intervention Program. And it's really looking at the collaboration of the hospitals in the city and some community service agencies and their ability to, all of whom you've heard from today, and their ability to identify hospital patients who are at risk of repeat violence and injury and link them with the community services to wrap around and support them in their growth and healing post the event. And also to prevent, right? So we heard about prevention this morning too. We're truly grateful to Trinity Health and St. Francis Hospital for leading the way through a long-term partnership with Hartford Communities that Care to respond to victims of gun violence. All of the partners have already been named, so I'm looking through my notes. The city recently also launched another important initiative to look at mental illness in our city and address it through the Hartford Emergency Assistance Response Team. And this is Hartford's, it's called the HART Team, and it's Hartford's brand new emergency response service to deploy mental health professionals in response to 911 calls in certain situations. So our dispatchers now have more tools available to dispatch police, fire, EMS, or a HART team responder, or sometimes in collaboration, sometimes on their own. So this is a brand new initiative launched a couple of months ago, and so far, I don't have firm numbers, but I will tell you we've responded to over 80 calls with the community response team, which means that's 80 calls that would have sat in queue for the police, but somebody else went instead. So it's showing good growth. We're opening it very slowly. I'm happy to report that so far we feel that we're making a big difference in what kind of response and paying attention to mental health of our citizens. City of Hartford will continue to work to build and provide a strong continuum of care to victims of gun violence in our ongoing efforts to prevent further violence and to promote a safer community. We are grateful to our federal and state governments and our government partners for COVID relief funds, which is really what supported the HVIP, and we're also grateful to everyone who's present here today for partnership and collaboration and thinking forward to prevention and thinking forward with hope that we can really make a difference in this. We're doing important work. Thank you.
Next, we have Andrea Gaverdi from Senator Chris Murphy's office. Thank you.
Hello, everyone. I have a letter on behalf from Senator Murphy. It says, "Dear friends, I wish I could join you for this morning's event for National Gun Violence Awareness Day at St. Francis Hospital in Hartford. In the wake of mass shootings in Uvalde, Buffalo, and now Tulsa, this rally functions as both a moment for reflection and remembrance of loved ones lost to gun violence in communities throughout our nation, and also as a moral call to action. I want to thank everyone at St. Francis for the incredible role you all play in the anti-gun violence movement. As we saw in Oklahoma this week and in Texas last week, nurses, doctors, administrators, and hospital staff and security all feel the direct impact of gun violence has on communities. Often left out of conversations on gun violence is the physical and emotional harm done to victims, families, neighbors, and caregivers here in Hartford and throughout the nation. The advocacy, expertise, and compassion of hospital staff during the aftermath of shootings is vital to making our communities whole again. Our power as a movement will be in the key to moving Congress to act. Our ability to raise our voices over the critical next several weeks could make the difference between legislative success and failure. And for me, failure this time is just not an outcome I'm willing to accept. After hearing the news out of Uvalde last week, I was shaken to my core. I was brought back to that December day in Sandy Hook 10 years ago. I was horrified, I was angry and scared, and I was also resolved. Over the past week, I have been working with my colleagues in the Senate on both sides of the aisle to find a compromise bill that can pass this Congress, that the President will sign, and that will begin to save lives. I am working 24/7 to get a result and have had countless phone calls and conversations with Republicans and Democrats who are focused on changing the narrative, and the government is helpless against stopping mass shootings and gun violence. We would not be having these negotiations if not for you and the movement you're a part of. Once again, thank you for your tireless efforts saving lives and working to put an end to gun violence in this public health crisis. I look forward to working hand in hand with everyone at St. Francis Hospital for years to come. Sincerely, Senator Murphy."
Thank you for that. I don't see Congressman Larson here, so it's my pleasure to introduce our governor, Ned Lamont.
Dr. Shapiro and Tom, and we keep coming back to St. Francis. Over the last few years, come here a lot about COVID, and more recently we've been coming back about violence, in particular gun violence. And I think we're beginning to win the war on COVID, thanks to each and every one of you, and the nurses in the back row there, and all the heroics you put in. Thank you for what you did every day. Some people could Zoom, some people could telecommute, and you showed up. And we can win the war on violence as well, but there's just too many fake arguments out there that are slowing us down. It's not about the guns, it's about mental health. Yes, it's about mental health. I was really pleased that just a few days ago, we passed the biggest investment in mental health, in particular focused on our schools, doing everything we can there, making sure that kids have a shoulder to lean on, somebody they can talk to, and somebody that can refer them as needed, and make sure there's no stigma, and make sure they can do it. Yes, it's about mental health. It's about interventions, and all the amazing services that are represented here, and making sure the right people respond as necessary. We've doubled down on that as well. No, it's about law enforcement. Well, there's some of that as well, and we've made our commitment there. We've made our efforts in terms of community policing, and hopefully community police that reflect the diversity of the community to give people some confidence that there are safe places. And it's just shocking to me that you see just in the last few weeks what's happened in a hospital, what's happened in a school, what's happened in a shopping mall, and you see it in churches, you see it in synagogues, you see it in all the places that people need to be safe. And when it was COVID and now it's crime, not only do people have to be safe, but they have to feel safe. And that's what we're working every day. And finally, when it comes to violence, and in particular gun violence, I don't wear a tie very often, so I know when I put on my orange tie that I'm coming back. Murphy and Blumenthal and our amazing delegation have been telling the story of Sandy Hook to Congress for 10 agonizing years with not much success. If the rest of the country had the gun safety laws that Connecticut does, there's a much better chance that that kid in Buffalo that was ranting away on social media, red flag law would have alerted people, and that kid maybe wouldn't have gone there. It's just going on too damn long. And we just strengthen our red flag laws. I hope that's an example to people. By the way, that kid wouldn't have been able to buy an AR-15. We don't allow them here in this state. We shouldn't allow them in this country. Nobody's taking away your guns, but these are guns that are meant to kill. I tried my heart out in this last legislative session when it comes to what they call ghost guns. These are plastic guns. These are guns that are meant to kill. These are guns that skirt our laws. These are guns you come by mail and put them together. These are guns that don't show up at TSA. These are guns that purposely don't have serial numbers on it so our police can't track it. And I couldn't get that through the legislature, and I need your help on what we're trying to do there so that Connecticut can continue to lead. So don't tell me it's not about guns, it's about mental health. Don't tell me it's not about guns, it's about criminal justice. Don't tell me it's not about guns, it's about interventions and wraparound services. It's about all of the above. And until our political leadership takes that seriously, we're going to be coming back here wearing an orange tie and grieving what happened in the mass shootings and probably what happened in one of our cities last night right here in Connecticut. So I appreciate each and every one of you. I love the speakers. You guys are amazing what you're doing. And you got to stand up. And Connecticut, I promise you, will continue to take the lead. Chris Murphy will continue to take the lead. Dick Blumenthal and John Larson, our amazing delegation. We don't have to vilify the opponents. We don't have to say, we just bring people along. And if it's not everything we want, it's going to be something. And every step will make an enormous difference. And I just pray to God that next year we have a much better story to tell, and our kids can feel safe, and mom can feel safe taking their kids to school, and you can feel safe going to church, and by God, make sure you feel safe coming into a hospital. Thank you.
Thank you, Governor. In closing, I'll be brief. My name is Dave Shapiro. I'm the Chief Medical Officer at St. Francis. I'm also a trauma surgeon, so Dr. Montgomery is one of my partners. In 15 years at this hospital, I've seen people from every facet of our community injured or killed by bullets. No one, it seems, is immune, and that includes our own colleagues, our own families, and our own friends. In all the syndromes and diseases we see in healthcare, there's one that's absolutely 100% preventable, and it's been spoken about earlier tonight, and that's violence. No modern medical miracle has been devised to prevent violence or the use of firearms to solve problems. Guns are not the answer. They are not a solution. They are not a treatment. They are not a therapy. And as the colleagues and guests that have been here tonight have said, plainly, enough is enough. We heard see something, say something, now we need to do something. And that includes the whole country. Prevention is key, and we heard that, I think, from Deborah and everybody else as well. And Deborah said it best. Prevention is absolutely key. The prevention that comes in the form of learning how to express our anguish and challenges of mental health to our family and friends and get recognized for them so we can intervene without stigma, to resolve conflict without violence, and with de-escalation and collaboration. And the programs in the city of Hartford and the programs in the state of Connecticut and the laws to support that are incredible and some of the strongest in the nation. The loss of life to violence we experience in the greater Hartford community leaves us inconsolable. And I know that the moms in the audience have heard me say this before. It's a sentiment that we share in the hospital and a sentiment that we share nationwide. So Governor Lamont, Congressman Larson and Senator Murphy, Senator Blumenthal, Mr. Woods, Ms. Santiago, Ms. Davis, Ms. McIntosh, thank you all for being here today. And this concludes our program. But I thank you from the bottom of my heart for being here and expressing your concern. Let's share that together.